Knee osteoarthritis. In obese people with knee osteoarthritis, a research published in JAMA on September 25 indicated that combining a tight diet with exercise resulted in less knee discomfort and increased function after 18 months. Current treatments for knee OA are ineffective, according to the article's background material. Current treatments for knee OA are ineffective. Diet and exercise interventions were placed in a clinic environment, with exercise groups having the option to transition to a home-based program. The trial included 454 overweight and obese older community-dwelling adults, age 55 or older with a BMI of 27 to 41, with pain and radiographic knee OA. The diet and exercise group reported reduced knee discomfort, increased function, faster walking speed, and a greater physical health-related quality of life than the exercise group. Diet and exercise group participants had lower levels of interleukin-6, an inflammatory marker, than the exercise group participants. Diet individuals exhibited lower knee compressive force reductions than exercise participants. Many life-threatening and devastating illnesses, such as OA, are much more common among the estimated 97 million overweight or obese Americans. The results of this trial suggest that intensive weight loss may have both anti-inflammatory and biomechanical benefits, the authors write. When weight loss and exercise are combined, patients can safely achieve a mean long-term weight loss of more than 10% with an associated improvement in symptoms greater than with either intervention alone.
Thank you for watching. Hope you will like the video I created for you. Please support me, click on subscribe. Then click on the bell. Please tap the below to view videos of the same series.